follow the rules.
Nice to meet you, man.
Something I'm calling Andy. They definitely locked their room.
Give you a little tour of the lab. This is our phlebotomy area. Follow me. This is our UA processing area.
Okay.
This is where we process our A1Cs.
Okay, cool.
This is our chemistry and hematology department, one of our fellow employees.
How you doing, sir?
Nice to meet you, man.
This is our processing area.
Okay.
Great, if you follow me, we'll continue. Go ahead and have a seat. How are you doing today?
Pretty good. Yourself?
Very good. So what we called you in because we really liked your resume. Mind if I ask you a few questions?
Sure.
Okay. Do you have any previous experience?
No, ma'am. I'm freshly new, about to graduate within the next week.
Mm-hmm.
I'm very excited, looking for an opportunity to start somewhere.
Okay. Do you have any previous work experience outside of
Previous
clinical?
work experience, yes. It's mainly retail. I currently work full-time, Ross Dress for Less. I've worked in construction as well before. That's basically it.
So you have experience with a team role?
Yes, ma'am.
Yes. Okay. During your clinical rotations, what kind of departments did you work in?
Well, for my first rotation was in hematology, coag, and UA, and that was at Christus Santa Rosa Medical Center. I got to work on great people there. I learned a lot. I especially liked it because I had to view a lot of cancer patients, so I got to see a bunch of leukemias, all the disease states involved with it.
Right.
That's where I learned my urinalysis. The machine that you have here that I saw is actually the same, so that was really cool when I saw it. And the coag, that obviously doesn't, yeah.
Right.
Does that get done here? No?
No, we actually test at Brady Green and Maine University for that.
Okay.
You did notice you had previous phlebotomy experience with us too. You did your clinical
Yes.
here.
So
That's good. Friendly face.
Cornelius' faces was really cool, yes.
Yes. Are you planning on taking your certification test anytime soon?
Yes, ma'am. Hopefully within the next couple of months.
Okay.
I'm actually lucky that the school is going to be paying for my exam, so.
Nice. That's always a plus.
Yes.
We also do tuition reimbursement if you decide to further your education, and we actually have a reimbursement for your test if you ever choose to work with us.
Cool.
Okay. So you're familiar with processing samples, the whole process of spinning and separating.
Yes, ma'am. Centrifugation, spin and separate, freezing the specimens that need ice. Yes, ma'am.
So when working in the lab, you're going to have some conflicts with other coworkers. How would you handle a coworker that you just don't get along with?
I would say that we're all adults. I mean, some people would probably say don't go straight up to them, but my philosophy is, like I said, we're adults. We can work things out, see what the problem is, and if not, we can then go to a superior and see what can be done from there.
It's a very good answer. Let's see. I'll take some notes.
I mean, I'm sorry to interrupt, but we're a team, so person to person, we'll be seeing each other a lot. So, like I said, if we can work things out ourselves, then there is an actual problem, and then the supervisor would be involved from there.
And we wouldn't mind stepping in and trying to solve those issues, and if you had any at all. But you seem very friendly. Let's see. How do you feel about I mean, do you have means of transportation to get to work every day?
Yes, ma'am.
Yes.
I have my own vehicle.
Mm-hmm.
If hired here, I live fairly close, so that'd be a plus as well.
Yes, yes. Do you see I mean, are you able to lift over 40 pounds?
I would think so.
Yes, okay. That's good. We do have to carry a lot of our own supplies in and put up supplies daily almost.
Okay.
We do file a lot of paperwork.
I got a little bit of a taste of that last summer.
Right. Yes. Let me pause it. Okay, based on your resume, I see that you do have a bachelor's degree. Can you tell me more about that?
Yes, ma'am. Science I've loved for quite a while now. It wasn't until my senior year that I realized that, I'll be honest here, they said that unless you go to graduate school, there's not much you can do with it. So, most of my courses had a lab involved, so I've gotten some experience with microscopic centrifuges, not analyzers, but the whole lab sense. So I was like, I really like this.
Right. So you have microbiology experience.
Yes, ma'am.
Awesome.
And that once I found out that I needed certification, that's why I came back for the MLT program, and I'm looking to get hired.
Nice. We would love to have you here if you choose us. What other Okay, so what do you think you could offer to UHS? What are your characteristics that you would love to bring to our system?
Well, I would say it's well known that Universal Health System is a busy health system. So I'm used to the fast-paced work environments, being retail. The store I'm currently at is the busiest in San Antonio. I'm just used to always staying busy, and I think it'd be a good fit with the Universal Health System. One, because I've been here as a student before, and I really like it. I mean, there's really no complaints from me.
I have one more question about customer service.
Mm-hmm.
How would you handle a customer that comes in with a problem and ask you personally how to fix this? How would you solve this? Who would you go to?
Okay, this actually happens many times.
I noticed you flinch. I'm sorry. Let me close the door. It's a little noisy. Okay, let's continue. Do you have any references?
Yes, ma'am. I apologize for the inconvenience as well, and for interrupting you, but I wanted to finish the question.
Yes, certainly. Please do.
For the customer who has a complaint, and for myself trying to fix it, it's happened many times. Myself personally would try or actually talk with them, see what the problem is, and then say if they can't find anything they want, I would call another store, or just I would just try and see what the problem was and do my best to be able to work the situation out. If I cannot, then of course I would go to have someone higher up from me, like my store manager, as an example.
Nice. You're showing a lot of independence, which is very needed in this profession.
I would say my customer service is really well, so I would think I would do well with patients.
Nice. As far as references, you have worked at other clinical sites?
Yes, ma'am. Sorry.
No problem. Okay. Nice. Okay. I'm gonna go ahead and hold on to this, but this would be your records for HR. Is that okay?
Yes, ma'am.
Yes. Okay. As far as your availability, what works best for you? Mornings, nights, middle shift?
I'm actually open to the ability. I saw that the position was set for evening shift.
Yeah.
Do you know exactly what those hours pertain to?
Mainly our evening shifts are 12 to 8.
Okay.
It's a lot of independent work because most most of the morning techs will leave by about 5 o'clock.
Mhm.
We do get customers in. It just depends. Sometimes we have busy nights and slow nights. Mainly, you'll have responsibilities of closing the lab, making sure everything's stocked, cleaning tabletops, sending any specimens out with the nightly courier. Um, do you have any questions for me so far?
What would you say that you like about University Health System? Saying that you already work here.
I've been here for 2 years. I really enjoy the independence it does give me. I'm working by myself a lot. They offer great benefits.
I've actually heard that. Yeah.
Yes, our benefits are really good. We offer all kinds of dental, medical, vision, the works. You get to choose and base it off of what you need too. If you have family, if you're married, children, whatever.
Okay.
They also do tuition reimbursement, which I really enjoy. It's a great stepping stone. We do lots of good work for students that come fresh out of school. We are a training hospital to where a lot of it is student based.
I guess that's one of the reasons why I like it here as well, because I mean, you said it yourself, you're a training institution, and so you're used to students coming in and out, so
Yes.
it was really neat.
Yes. It's a good start.
Okay.
And we try to prepare you not only for this job, but any career after.
Okay. I have one more question, if I may. As far as other, not pertaining to this, I guess the whole system in general, do the techs usually rotate the areas of the lab, or they all usually are assigned to one and you'll stay in that one area?
We are a general lab where you do have to focus and rotate through every department.
Mm-hmm.
So we do hematology, chemistry, we do hemoglobin A1Cs, urinalysis. There's times where you're going to have to draw blood, and there's times where you're going to have to clerk and process, actually register the patients. Now, if you work for University Hospital, that's a little different. That you may be just designated one area to work in, but it just depends. And there is, I don't want to say requirements, but there's opportunities to work at other labs, not only the one your main home is, but we do travel because we have 6 outpatient labs to where you may be called upon to go work or cover a shift. Do you mind covering?
Actually, it's not a problem. You get to meet other people in the system and network with other individuals, and yeah. Okay.
It was a pleasure interviewing you. You look like a great perspective.
Thank you.
I'm going to pass this all to HR, and we'll be calling you back shortly. Is there anything else I could help you with?
No, ma'am. Everything was fine. I enjoyed my visit. Thank you.
Thank you.
Mm-hmm.
Let me walk you out.
Okay.